Dr. Silva, you deal with a lot of kids. Is this a learning opportunity, a teaching moment as well when we bring our children to get vaccinated?
I I think a lot of families have heard and have had personal experience that the infection, it does not seem as severe in adolescents and children as in our uncles and aunts and grandparents and parents. And so people feel maybe less fear or less urgency to get the vaccine for their kids. Uh, On the other hand, there have been more than 8,000 children admitted to the hospital with serious coronavirus infections. And in just the group between 5 and 11, there have been almost 200 children who've sadly died from the infection. And the question is, how many, which children should we protect? How do we convince parents? Um, you know, it's difficult for parents to sort of accept those numbers unless, unfortunately, one of those 200 children. Uh, I try to be very gentle and inviting when I discuss this with parents because numbers don't convince people. It's I have a background in science, so I can understand science and numbers. They really speak to me. But the same things that I would use to convince myself are not necessarily convincing to families or adolescents.